Hi everyone, my name is Jamie Smith. We are here on Nurse Deck today and we are interviewing Michelle Lemmons. Hi there, Michelle.
Hi, nice to be here.
We're very happy to have you here. We are excited to interview you, Michelle. Can you walk us through your work in the surgical industry and tell us about your advocacy?
Sure, I would love to. I love the word advocacy. Probably hear me say that about 50 times if you get to know me a little. So I started off my surgical careers. I've been a registered nurse for longer, but my surgical career was here at the University of Minnesota. They had an opportunity to do their Periop 101 program. So I entered that, just not ever knowing anything really about surgery. We didn't have a rotation in college or anything like that, just interested. So I entered their Periop 101 program and then worked on their cardiovascular thoracic team and general team for a couple of years at the University of Minnesota. And after that, I took some time off, not only from surgery, but also from nursing, just because we had our first child. And so it kind of changed. You can't do the whole weekend call when you have a newborn, or you can, but it's tough. So I had the opportunity to be able to stay home for a while, and I took that opportunity. So after that, I kind of just did a few things here and there because I was working casual and part-time, just with the kids. We ended up having a second child. And pardon my cat here, that's Cheeto exploring in the background. And so after I was really ready to kind of come back to work, I heard about a position at Key Surgical, which is a medical device company, but they were hiring for an operating room clinical educator. And I thought, man, that would be really interesting, kind of a very comfortable realm for me, which is surgery, but also something brand new, which is education. So that's not only for their, inner company, which is now it's a part of Steris now, a larger company. But also, we go to facilities and we do education. We do a lot of, like if you called me from your facility and say, hey, we're having this going on, can we do something like that? We can come to your facility. We can do virtual, tons of on-demand education, as well as a lot of education for sales reps. And in addition to that, I work casually in the operating room near me. And we kind of there's no teams, so we kind of do it all, which has been a really fun adjunct to the teaching part. To be able to also be doing it still, I think is a big deal.
You said you took the Key Surgical position and it was educational related and you decided it's brand new. Why not give it a shot? And that's what you ended up doing. Is that right?
Yeah. And I absolutely love it. Not only I think I saw the medical device world as that's for salespeople. If I'm being honest. So finding a role that was not, I don't do sales. That's nowhere in my, realm. But working for a company that actually kind of cares a lot about education and invests a ton of resources into that and wants best practice and wants it to be available and relatable to the person is really exciting. I'm kind of a nerd out, as some would say. I go nerd out because I really enjoy being able to have those resources and kind of give it to people easily and free and quickly.
I'm with you. I'm not one of those people who likes to sell stuff. However, if you're passionate about something, though, it just kind of comes naturally,
Yep, exactly. Yeah, sales is not bad. That's not what I'm saying. It just never was in my realm.
So what is it like being a surgical nurse?
Yeah, surgical nursing is, I think a lot of people would love it. I think a lot of nurses, it's like quintessentially nursing. When you think about the things that you enjoy as a nurse, you have your own professional kind of role and space. And I feel like in surgery, those roles are very clear, probably more so than they even are on the floor in different areas. Your job requirements, should I say. But on top of that, it's kind of a great mix of flexibility and this rigidity and structure. So I think that's the part that everybody kind of says you either love it or hate it. Also, it's nursing is good. When you work in the operating room, you can either walk in and you're like, this is for me. I love this. Like the organization of it, the flow, that independence and flexibility, kind of all of those seems weird to be united, but I think you kind of get that in nursing where it makes sense. You have these areas that are just very structured, and other times when you're like, nope, that's not going to be best for now. And you have a lot of that control, which I really like. So I think before I went into the operating room, I thought I'm going to be doing surgery. That was my idea of it. And then when you get into the operating room, really, some facilities will allow you to scrub in, so you're kind of doing that role as a surgical tech. Some facilities don't. If you're the nurse, that they have enough surgical techs, or they have that specialty where they don't do that. So like at the U of M and at the role that I'm in right now, sometimes you do end up scrubbing. And that really is that role that I think everybody thinks of when you think of the operating room, where you're standing next to the surgeon, you're scrubbed in and you're sterile, you set up the sterile field, you're handing instruments, you're assisting in those small ways. But there's also the circulator role, which if you've spent any time in surgery, they're kind of the one in the background who's not sterile, who is getting everything. They're kind of the manager, right, of the room. They're getting everything ready. They have what you need coming up. They're looking at you for those eye signals to say something's wrong, I got to get something ready, or, oh, I think we're coming up to the next part of the procedure. So they really organize. They're the eyes and ears of the whole room, and kind of getting everything, maintain that safety for that patient totally across the board. That same nursing role, whether it's skin or it's, we're going to have an emergency coming up, so I need to call for some help and get some other things set up. So that's the circulator role. So there's kind of different positions in there.
I've never done surgery. I've been in healthcare for 13 years, RN and nurse practitioner. And every time I hear of a surgical nurse, I think, just like you said, you scrub in, you put, the sterile field on, you hand stuff to the physician. But then you mentioned the circulator role, where you're in the background, kind of like a manager, where you're the eyes and ears. I have never heard of such a thing. So
yeah, so it's really interesting. So you can imagine like different types of nurses. The thing that's so cool about nursing is you have all sorts of different types of people, right, who like different things. So some just are like, yes, let me scrub every day. I love that. Hands on, no charting. I feel great about that. Or you have the circulator role. That's really that manager, see the whole picture, planning for the next step, documenting everything, and kind of keeping people updated and really aware of all the cues that are going on in the room. So there's a bunch of different roles for kind of any type of person.
So I'm curious, the circulator nurse, would that person be like working with the anesthesiologist too, saying, hey, their blood pressure's tanking, or are they kind of independent and do their own thing?
A little bit independent. It depends on kind of where you are in the size of your facility, of course. Typically, the anesthesiologist or the CRNA is the one in the room. The CRNA, the anesthesiologist might come at the beginning for induction, and then they go because they're managing a couple different rooms. And the CRNA is really the one who's doing all of that. Now, that's, I think, inherent in nursing, is that you're kind of watching everything all at once as much as you can. So you might be watching and thinking like, hey, this might be a cue for something. Anybody else you looking? Yeah, and just like in every other role, you kind of know your team. You know who you're working with, and you're like, this person is definitely watching. They're already all over it. This one, I might just say something. Typically, you're there as, the circulator is really there as everybody's resource and the monitor for all of it. So, you're still listening to all the beeps and listening to make sure that, and kind of watching for that baseline. You kind of see those things peripherally. But typically the CRNA is like, they're wonderful. Of course, they have an incredible role. So they're all over that. And then you're just there if they kind of need something like, hey, can you call the runner for me? Because I'm out of this and I need this.
So Michelle, thank you for the insight on that. I've always been interested, CRNA role, and then you brought up the circulator role, nurse. And so thank you for that. What are the major challenges surgical nurses face amidst the pandemic, and how is it being addressed?
I think like a lot of different areas, surgical nurses are having a few of the same issues, right? We're having staffing issues. For a long time during the pandemic, a lot of surgeries were postponed. So you had a lot of surgical staff that was transitioned out into other areas and had to be trained to kind of do other things. And, a lot of that has come back now in many states, some, kind of flex back and forth. But so we have the staffing issues. we kind of have those training and switching roles and transitions, for sure. And then, some places had layoffs, and some places, now are facing a huge issue because they have this backlog of cases. So they're doing overtime, they're doing extra shifts, they're doing bonuses. So there's been kind of this very strange, like that same phrase, hurry up and wait. It's like,
Yeah.
ooh, it feels like that. For a lot of places, it sounds like it has felt like that, is what I should say. Like, we're going to switch over here for this many months, and now we're going to come back. On top of that, nurses are people. We're just people. So also have been dealing with a lot of the questions and the unknowns and the concerns and the calls from family members. What do you think? What's the best thing to do? And depending on who you are, again, like, that is very, very challenging to navigate a lot of that. So just like a lot of other areas, we're having a lot of questions, like, is this what I want to be doing with my life and healthcare and things like that? And is this the risk that I'm willing to take? How do I take care of this patient? What do I do if I have COVID? What's the policy now? How many days do I have to be out?
Right.
Or can I come back right away? Huge question mark, depending on the day. Really, if I'm being honest, depending on the day. Vaccination status, there's a lot of, all of those are, I think, just everywhere. I think the other area in surgical nursing is sometimes that relationship, the hierarchical kind of relationship that can happen in the operating room with surgeons and techs and nurses, and a little bit of, depends on your facility. Again, I'm not making a sweeping statement, but that can be a very challenging relationship. And so if you add that to already kind of that feeling of powerlessness from just the changes in the world, I think some of that is really starting to bring forward those feelings of like depression and helplessness. And we're seeing a lot of that across the board in healthcare. And it's the same in the operating room. The thing I think that is helping, in the operating room, or things that they're doing about that, is having good leadership and having good management and having good resources. Like the Association of Perioperative Registered Nurses is great. They have like a very easy to follow, laid out, here's kind of what we should do. And then American College of Surgeons and a couple other organizations got together right at the beginning of the pandemic and made, here's how you make your choice. Here's how you decide, prioritize which patients, and how you can kind of work through some of that. So there's a lot of resources, especially specifically for surgery, that are out there that say, here's a great way to work through backlog. Here's a priority checklist for how to make a decision on which patients to go when. Here's how you specifically, it was anesthesiologist, the association, I can't remember what it's called right now, that said, here's exactly what to do if you have a patient positive for COVID. Are you going, directly into the respiratory cavity, the respiratory space, or are you not? And then kind of had that tree to follow, that decision tree. So there's a lot of good resources out there. And then there's a lot of good managers out there that are keeping their staff up to date and saying, like, don't worry about it. I will follow it, and let me be your resource and just ask me. On top of that, I think we've had a great opportunity in healthcare to talk about the issues that were already there, that were already long-standing issues. And now it's like, hey, that's enough. We can't do that anymore. So we get this opportunity to kind of make some changes that have needed to be made for a long time.
You mentioned a lot of great points. So surgical nurses, we're in this pandemic, and you mentioned staffing. Everybody mentioned staffing, but you mentioned there's been a backlog of cases. And so therefore, everyone's trying to stay current with all the surgery. So you're having to work overtime, get these bonuses. But like you said before, we're human. We can only work but for so long, and that ultimately can lead to burnout. And then you mentioned, I thought it was interesting, you mentioned the hierarchy. Like you mentioned the aides, the nurses, the surgeons, and how some already feel powerless and depressed as it is. And I thought it was interesting you brought out how that further worsened like depression.
Mm-hmm. Yeah, there's some really interesting research around that. There was a presentation that I've been doing It's called Nurses Eat Their Young because they're starving. So people have been really asking for that presentation a lot. And in it, we talk about, depression and just overall enjoyment of their career. And so what a few studies found was that pre-op nurses, before the patient goes into surgery, they enjoy their career the most. They're actually the most satisfied. They really like that. Whereas intraoperative nurses actually are the least. Like, they have higher scores of depression. They have that very unique space. There's a lot more research to be done in that area. But again, it's very unique. It's that organized, structured, hierarchical, kind of some of those things that nurses who are a professional, independent group are like, ooh, wait a minute. I don't know if this is going to be okay.
And I didn't know that about the research and the depression scores being high there. So thank you for that.
Yeah, actually, female nurses just outranked female physicians. They kind of did a lateral study to see, which same gender, same roughly age, same roughly years of experience, and female nurses were higher. So the nursing profession is really hurting in those ways. Good opportunities for moving forward. Lots of hope there, but also it's really good to see that information so that the conversation can be better or richer.
Right.
Yeah.
Michelle, being in an operating surgical room is obviously very stressful. What do you think can be done to improve the wellness of surgical nurses?
Yeah, great question. I think a lot of things. I think education is huge. Again, like, even having that information and conversation is such a big deal, about depression or about best practices or about how to use a machine. Everywhere in healthcare, you get some new device probably every day or at least every week where you're like, I've never used that. And then surgery is it's all the time. It's literally every day. You got a new thing and a new rep coming in to show you that you're going to use for one surgeon for one case. So then, it can be a very wide breadth. So lots of education, not just, hey, sit down and listen to me for 20 minutes, but like, give it to me and let me see it, let me do it. A lot more stimulation, which I think we're seeing, which is great. So educations and conversation, I think, are probably my top two, just really giving people that opportunity. And then I think overall in nursing, getting back to that role clarity and that professional independence to say very clearly, like, here's the things that you can do on your own, that you are the leader of. I think some of that can kind of get lost, especially as you're transitioning from different roles in a hospital, or need to be reminded of it when everything else is kind of changing around you. Like, wait a minute, here's where I have control. Here's the things I can impact. Getting involved in organizations like AORN or the Association of Surgical Technologists, AST, can give you that like bigger than yourself mentality to say, oh, wait, I can have this role in this organization and make an impact, from the kind of an outside in perspective and also the inside out. So not only your clubs and organizations and at your facility, but those larger organizations have tons of opportunities to get involved.
I respect how you mention education, because I'm all about education. It's like there's something new to learn every week, I feel like, in a long-term work. But you mentioned best practices, and it's always ever changing. It's something new every day in surgery. You said if I heard you right, you said sometimes you might have one physician who wants to do surgery one way and he goes somewhere else and the surgeon may do it a different way. Is that how I heard you?
Or even in the same facility. So if you have maybe two surgeons can do the same type of procedure, they might do it differently. One might use this machine and one might use this machine, and one likes these settings, and so it's not just per procedure. It's per surgeon, per case, per unique identifier for that patient. It's very specialized. A common phrase in surgery is, I always do it the same way. The surgeon says, I always do it the same way. And if that were true, great. But I don't do anything the same way either. Even make toast. Nobody does. We kind of have a little bit of flexibility there. So We definitely have a lot of that unique need in surgery, which is something to really love about it. It's fun to be like, "Ooh, I got this." Like, I know that he's gonna like this, or she's gonna need this at this time in her surgery. So, really fun about it, but also is really challenging to make lists and retain information and put posters up in every OR for this surgeon wears this gloves and likes it this way.
Right.
Communicating all of that together.
That's a lot.
Yep. It is a lot. I'm learning new surgeons right now, so I'm fully reminded, like, oh, geez, that's right. I forgot about that part. But
So
also
tell
fun.
us, Michelle. Yes. So I have one more question for you, Michelle. So what should the future of surgical nursing look like?
Yeah, the future of surgical nursing should be. I really have gotten passionate about people like getting their certifications for themselves, not just to get whatever bonus at work, but kind of taking back that idea of nursing as its own independent professional space. I think that's huge. And then when you get into a specialty like surgery, it's such a cool opportunity to make it excel. Like you really make a significant difference because you're in a smaller pool. So you get your certification, you start getting involved in AORN and your other bodies, and it kind of seems like why would I do that? It's just like another thing I have to do. But man, it motivates the profession and it moves it forward. So I think the future of surgical nursing is kind of going back a little bit, actually, to more nurses getting certified, more nurses feeling like, hey, yeah, this is for me. I can get involved and make a difference in my individual specialty, in my profession. Because I think that's going to just not only make work more worthwhile, we spend over a third of our time at work in our lives, but also patient outcomes. It's just proven, of course, across the board. That more certification and specialty, the more kind of involved you are, the better. And for some people, I realize like it's not an option, and that totally. But I think that's also a great space for surgical nursing too, is to make that availability for everyone, make it accessible and transparent.
That is good. I like how you mentioned getting involved and getting certified. If I heard you right, you mentioned AORN. What does that stand for?
Yeah, the Association of Perioperative Registered Nurses.
Okay.
They're
So it
kind of
sounds
like the gold standard for guidelines, but that's also, the certification body and
cool.
things like that.
I was wondering what that was. Okay.
Yeah. Yep.
Well, thank you for your interview and your time today, Michelle. We really appreciate it.
Yeah, thanks for your time. That was fun, and I had a great time talking with you.
Had a
I wish
blast.
I could interview you back and hear all about your.
Oh, you're sweet.
Yeah.
Sweet. Well, thank you. Thank you, everybody,
you.
for listening today.